Hey there, this is Rick Thomas with Thomas Family Insurance coming to you with your Medicare Monday. Today we're going to talk about Medicare Part B in 2025, what it costs, what it covers, what it will do, and what it won't do. And again, as a reminder, this is talking about if you only have Medicare by itself. If you don't have Medicare Supplement or Medicare Advantage, if you only have Original Medicare Part B alone, that's what we're going to be talking about here today. Most people don't. Most people have a supplement or an advantage plan, but we're going to talk about what Original Medicare Part B will do all by itself today. All right, so what is Medicare Part B? What does it do? It basically covers the doctor part of Medicare. It covers outpatient services and medical services at the doctor's office, the hospital. For the doctors who do things while you're there, it goes under Medicare Part B. It is part of Original Medicare. Part A, we talked about before, is the hospital. Part B is the doctor, and it helps pay for doctor visits, preventative care, medical treatment, things like this. All right, so breaking it down a little bit more, we're covering your doctor, we're covering durable medical equipment. Some home health care visits are covered under Medicare Part B. Some are covered under Medicare Part A, kind of depends on the situation. Does cover outpatient services, even if it's done at the hospital, like the surgeons and whatnot, will be done under Medicare Part B. Does cover mental health, covers ambulance, and some preventative services like your mammograms, flu shots, colonoscopies, things like this. All right, so how much does Medicare Part B cost this year? The standard premium would be $185. $185 is what Medicare costs for most people, not everybody. Some people will pay less, some people will pay more. We're going to talk about that a little bit later. Medicare Part B also will leave a deductible of $257 before Medicare will cover anything. You got to pay that first $257 out of your pocket. Then Medicare will cover 80% for most services that are under Medicare Part B, meaning you pay 20%, they pay 80%. The problem with Original Medicare by itself is there is no maximum out of pocket. So 20% of a lot of money can still be a lot of money. So Original Medicare by itself, Medicare Part B and Medicare Part A by itself is not a good idea. That could be subject you to a lot of out of pocket expenses. All right, so I said most people will pay for $185, but some people get hit with what's called IRMA. IRMA is income related monthly adjustment amount. This is a wealthy tax, is how I like to talk about it. If you make good money, you're going to be paying more for your Medicare compared to the people who don't make as much money. The people who make very little money don't have to pay for it. It is funded by the people who do pay, who do earn more money. So if your individual income is over $106,000, or if you're married and your income is over $212,000 per year, you can expect to pay more for your Medicare Part B premium. It could be as little as $259 more or up to $628. And this does affect Medicare Part B and Medicare Part D premiums. So this breaks down the exact dollar amount. So if you are single making $106,000 or less, or married filed jointly under 212, your regular premium is $185. But then check it out if you make more than that. So if you're between 106 and 133,000, or 212 and 266 for a married couple, you're going to pay $259 for your Medicare Part B instead of 185, and you're going to get hit with a Part D IRMA of an extra $13.70 per month. And it gets worse the more money that you make, all the way up to if you're making more than $500,000 individually or $750,000 as a married couple, you're going to be paying $628.90 a month for your Medicare Part B premium, plus an extra penalty of $85.80 a month for your Part D. This is per person. So if you're a married couple making over $750,000, you're going to be paying a lot more for your Medicare. But of course, your income should be able to reflect that. You should be able to cover that if your income is this high. The problem we run into, though, is when people do a one-time outlier that changes their income. For example, they cash out their 401k, and now all of a sudden their Medicare premium is higher, or they sell a property, or they get an inheritance. Kind of a one-year deal. It's not a constant income stream. They're going to get hit with that Part B premium IRMA penalty, usually 2 years after the you filed the taxes. So, for example, in 2025, this is going to be based upon your 2023 uh, tax income brackets. All right. Some people get extra help paying for their Medicare, and these are for the low income population. You can get what's called the QMB for qualified Medicare beneficiary. And it helps pay for A and B premiums, the deductibles, and the co-payments, very similar to Medicaid, but on the federal level. And the income requirements for this is monthly, you got to be below 1325 as an individual or 1783 a month for a married couple in order to qualify for that QMB. The SLMB is a little bit easier to qualify for. This is a specified low income Medicare beneficiary, and this is going to only help pay for Medicare Part B premiums. So these people don't have to pay the 185, but they still have to pay the 20%. The income requirements for this is $1,585 for an individual or $2,135 for a married couple. You can also do the QI. This is easier to qualify for, but it is also limited as far as how many that you can get. So you need to apply early for the QI if you want to get that. The qualifying individual program will help pay for that Medicare Part B premium, and that's if your income is below $1,785 individually or $2,405 as a married couple. So if your income is close to these, it's worth talking to the Medicaid office or Social Security office to help get that extra premium paid for. All right, other ways we can help to reduce the Medicare Part B cost with original Medicare by itself is you can enroll in what's called a Medigap or a Medicare supplement. These plans will pick up the 20% and the deductibles that Medicare leaves behind. These are at extra premium. You have to pay on top of your Medicare premium, but it picks up some or all of what Medicare leaves behind. And it does say if eligible, because some states you have to pass underwriting in order to qualify for this. So if you've been very unhealthy in Iowa or Missouri, they may not want to take you. Illinois has a plan, Blue Cross Blue Shield of Illinois. They'll take everybody regardless of health history, but their premium also reflects that. People should also consider Medicare Advantage plans. The bare minimum, an Advantage plan has a maximum out of pocket, something that Medicare does not have. So most of the plans will leave no more than $3,000, $4,000, or $5,000 out of pocket cost, but that's much better than what Medicare would do. And like we talked about before, you can apply for some of those programs like Medicaid or Extra Help or the QMB, QMB Plus, SLMB, those programs through the state. And most importantly, use your preventative services. These typically don't cost you anything, and if there is something wrong, the earlier you find it, the better chance you have of beating it. All right, so while we're in the hospital, Medicare Part B still kicks in. Now we have the deductibles and co-payments for Part A we talked about last week. Part B is going to cover your outpatient services or your doctor bills while you're inpatient in the hospital. So you're going to be paying the 20% of every doctor who looks at your chart, every test, every procedure, everything that happens while you're in the hospital. Medicare Part B is going to leave you a 20% co-insurance. The emergency room is also going to be covered under Medicare Part B. And again, it's 20% of everything that happens while you're in that emergency room. So A and B. A is when you're admitted to the hospital, and it is, again, the building part of Medicare. Part B is the doctor part of Medicare. And if we're in the hospital, we're going to get charged under A and B with no limit. Keep that in mind. All right, some takeaways. Medicare Part B is going to cover essential outpatient services. You're going to have to pay your monthly premiums, usually deductibles and 20% co-insurance. There is no maximum out of pocket with original Medicare. So you can look at supplements or other advantage plans or assistance programs to get some help. All right, to kind of give you some examples of why Medicare Part B by itself is not a good idea. If we take a look at some common costs like chemotherapy, might rack up over $150,000 per year. Well, Medicare is going to cover 80%. That's still going to leave you $30,000 to pay out of your pocket if we have to go through a typical chemotherapy treatment program. Now, if we go through dialysis, through kidney disease, again, it's estimating about $90,000 per year, leaving you $18,000 out of pocket. And something as simple as a knee replacement surgery could cost you about $7,000 out of your pocket. with Medicare covering the 80%, you paying 20%. And again, keep in mind, this is just the 20%. This doesn't include the deductibles. All right, that's it for this Medicare Monday, brought to you by Rick Thomas with Thomas Family Insurance. Again, you have our cell phone number, my cell phone on there, 217-740-4166. Or you can call the office. Trish is working Monday through Friday, 9 to 3 p.m. She can be reached at 217-771-1722. To get official information, you can go to Medicare.gov, and they have all that information right there, or consult your Medicare and You handbook that nobody reads. All right, thank you very much. I hope you guys have a wonderful week. You guys have any questions at all, don't hesitate to reach out. Thank you very much, and God bless.